Hello students, welcome to a discussion of glucose 6-phosphate dehydrogenase deficiency, G6PD deficiency. This is an important clinical case for first MBBS examination. It can be a SAQ or it can be a LAQ when it is linked with the HMP shunt. HMP shunt, hexose monophosphate shunt or pentose phosphate pathway or phosphogluconate pathway is important pathway for the generation of ribose, pentoses and NADPH. This is significance of HMP shunt. It provides ribose and NADPH. 60 to 70% of NADPH produced in the body, it is given by the HMP shunt. Now, what is HMP shunt? Hexose monophosphate shunt. Why it is called as shunt? Because glucose by the alternate pathway, it is converted into or oxidized into CO2 by this shunt. That's why it is known as shunt pathway. Alternative pathway for oxidation of glucose into CO2. This is also known as monophosphate, hexose monophosphate, because there is generation of monophosphate compounds. As in glycolysis, there is generation of bisphosphate. Here, there is production of monophosphate. Now, in this pathway, glucose 6-phosphate is converted into or oxidized into 6-phosphogluconolactone, which is hydrolyzed into 6-phosphogluconate, and by oxidative decarboxylation, it is converted into ribulose 5-phosphate. This is oxidative phase of HMP shunt, where glucose is converted into CO2 and there is production of NADPH. And this phase, oxidative phase of HMP shunt, occurs in the liver, RBCs, adipose tissues, adrenal cortex, lactating mammary gland, and gonads. It is specifically important in the tissues where reductive biosynthesis occurs, means fatty acid synthesis, then cholesterol synthesis, and steroid synthesis. Then ribulose 5-phosphate enters the non-oxidative phase where interconversion of sugar occurs. If there is deficiency of glucose 6-phosphate dehydrogenase, so NADPH production will be reduced. And NADPH is important in the RBCs for two important functions because of antioxidant activity, and it keeps the iron in the ferrous state, so it prevents the methemoglobin formation. Antioxidant property of NADPH is very important in RBCs, and that's why it is important in maintaining the integrity of RBC membrane. As such, the person with G6PD deficiency is asymptomatic, but when he exposed to oxidant drugs or infections or favabin consumption, in these cases there is generation of free radical occurs, and as there is reduced activity of NADPH, the free radical damages the RBC and rapid hemolysis of RBC occurs. Now see, there is free radical production when person is exposed to certain infection, or when he consume the favabins, or when the certain drugs are given, specifically the sulfonamide, primaquine, nitrofurantoin, acetinolide group of drugs. When these drugs are given, when the oxidant drugs are given, there is production of free radicals occurs. And these free radicals, they are scavenged by the superoxide dismutase enzyme, which converts this free radical into hydrogen peroxide. This hydrogen peroxide, it is scavenged by the glutathione peroxidase, and for this activity, reduced glutathione is required. This is reduced glutathione which is required. Now, reduced glutathione in this process is converted into oxidized glutathione, and it is again regenerated with the help of glutathione reductase. Now, for the activity of glutathione reductase, NADPH is required. In this way, NADPH is important for scavenging the free radical for the activity of glutathione reductase. So, glutathione, as NADPH production decreases when there is G6PD deficiency, glutathione reductase activity also decreases, and reduced glutathione production also decreases. So, there is decreased production of reduced glutathione. Reduced glutathione is very important in the RBCs for maintaining the integrity, because it prevents the lipid peroxidation, it prevents the membrane from the damage, RBC membrane from the damage from the free radicals. So, in the absence of, or in the decreased activity of NADPH, and reduce glutathione production, decrease activity of reduced glutathione, the membrane, RBC membrane damages, and that causes hemolysis. That causes rapid hemolysis, which causes anemia, which causes jaundice. Anemia and jaundice. These are the two important symptoms in the G6PD deficiency. So there is drug induced hemolytic anemia. As such, patient is asymptomatic when he is exposed to infection, when he is exposed to certain drugs, oxidant drugs, or when the certain food stuff, for example flavavins, when it is taken in the diet, it causes the rapid destruction of RBCs, because person having the less activity of G6PD, that is glucose 6 phosphate dehydrogenase, because of that less activity of NADPH and less activity of reduced glutathione, so that damages the RBC. Because of rapid destruction of RBCs, hemolysis occur and there is anemia. Because of rapid destruction of RBCs, the breakdown of heme will occur and bilirubin will produce, and that causes unconjugated increase in the indirect bilirubin level. So there is anemia and there is jaundice in the G6PD deficiency, but mainly it causes the drug induced hemolytic anemia when person is exposed to the drug primaquine, antimalarial drug, nitrofurantoin, then sulfonamide, acetinolide group of drug, dapsone, which is given in the treatment of leprosy. This drug induces, or these drugs causes the rapid hemolysis in patient with G6PD deficiency. It is as such a symptomatic condition. It is X-linked recessive disease and it is one of the common disorder. G6PD deficiency is one of the common disorder in the enzyme deficiency. Okay, so because of damage or compromise antioxidant function, and as decreased NADH favors the methemoglobin formation, there is hemolysis which causes anemia and which causes jaundice. Now let's discuss one case. A 30-year-old male patient came to OPD with chief complaints of pain in abdomen, jaundice. The symptoms developed when he was on primaquine therapy. This is hint here. When he was on the primaquine therapy, it is given to prevent the relapse of malaria. Okay, therapy to prevent the relapse of malaria. Hemoglobin was 8 gram percent, means anemia, and indirect bilirubin was 9.1 milligram percent or milligram per deciliter, means there is increase in the unconjugated bilirubin or indirect bilirubin. Indirect bilirubin. So this indicates, as the drug therapy is given here, or drug therapy was given, primaquine therapy was given. So this is a jaundice, there is anemia, and primaquine is a drug which is given in the treatment of malaria. It precipitates the G6PD deficiency. That's why here probable diagnosis is glucose 6 phosphate dehydrogenase deficiency. Remember, it is asymptomatic condition, but person when exposed to the certain infection, when he consumes certain beans, that is fava beans, or when the drugs are prescribed, oxidant drugs are prescribed, it can precipitate the G6PD deficiency because of decreased NADPH level. This disease is connected with HMP shunt, Hexose monophosphate shunt. What is significance of HMP shunt? Production of riboses, means pentose, and the NADPH. HMP shunt, alternative pathway for oxidation of glucose into CO2. This is important SAQ, this is important clinical case, this is important LAQ when it is asked with HMP shunt. So this is all for the G6PD deficiency. Thank you.